Okay, in this section, we're going to start looking at the skeletal system. And here is the function of the skeletal system. Now, keep in mind, whenever you see function, the word or the statement function, those are test questions, okay? Because this is structure and function, or an anatomy and physiology class. So the function of the skeletal system is support, and it does support it gives us our framework. It allows for weight bearing. It offers protection, such as the skull protects the brain, and the ribs protect the vital organs. Such as your heart, lungs, kidneys, liver. Okay, the skeletal system also allows for movement. So bones are attached, or muscles are attached to bone. So a muscle tapers into a tendon and attaches to bone. Okay, that attachment site is called the enthesis. Okay, we'll talk more about that in a minute. The skeletal system is a good place for storage, such as minerals and calcium, phosphorus, and fat. Okay, the bone does offer blood cell production. Okay, so the bone marrow, which is inside of bone, gives rise to your red blood cells and white blood cells and platelets. Okay, bone, cartilage, tendons, and ligaments are all considered connective tissue. Okay, they are strong and tough. They do have an extracellular matrix. Okay, in the extracellular matrix, it's responsible for the integrity of bone. So one way you can look at this is you have the cell. Okay, so that's intracellular. And then outside would be extracellular. Okay, so the extracellular matrix is on the outside of the cell. The matrix contains a collagen. So it's made of proteins, and it also has proteoglycans. And one of their jobs is to attract and retain water. And the matrix also contains water and minerals. Okay, the extracellular matrix is a large network of proteins and other molecules that surround, support, and give structure to the cells and tissues in the body. The extracellular matrix helps cells attach to and communicate with nearby cells, and plays an important role in cell growth, cell movement, and other cell functions. Okay, on the mineral part, some of the top minerals that we need, or that bone has, is calcium, and so vitamin D, calcium, and then there's magnesium, silicon, vitamin K, and boron. Okay, Himalayan salt is, as an option, you can put some in your water. Okay, so like your water bottle. It has over 85 different minerals that are good for the body, the bones, and the teeth. Here's some examples of that. So calcium, iron, hydrogen, zinc, nitrogen, phosphorus, carbon, fluoride, palladium, cadmium, chromium, arsenic, silicon, vanadium, gallium, cobalt, indium, iron, magnesium. Okay, just to name a few. Here is the difference between table salt and the pink Himalayan salt. And the table salt is has a lot of additives in it. It's been depleted of its natural minerals. They usually add an anti-caking compound, and it can contain iodine and fluoride. Whereas pink salt contains the essential minerals that the human body needs. 85% sodium chloride and 15% of it is your trace minerals. Helps regulate blood sugar levels, helps regulate the body's natural sleep-wake cycles. So there's your circadian rhythms. Helps promote healthy balance of the cells. So all these that I listed here are found in the Himalayan salt. So it's a recommendation actually to your water bottle to add a pinch of Himalayan salt so that you're getting this in your body. Okay, the other thing that is good for bone is regular exercise. Okay, so it's the pull against gravity. Okay, we can also say resistance training, or simply lifting weights. Okay, this is really good for healthy bones. So diet and lifestyle are going to play a role in healthy bones. Okay, here's some pictures of what we just talked about. So here's some hydroxyapatite crystals, and that is part of what helps with integrity of bone. You also find this stuff in cartilage, so hyaluronic acid, your collagen fibers. Okay, so there's your protein. As a recommendation, you would want to take your collagen supplement. And so it's kind of like a protein powder. So you just simply put like a scoop into your water and have it for the day. Or that would be your dose for the day. Every morning I try to do that, with my bottled water, put a pinch of Himalayan salt in, and then the collagen supplement. What you're getting is your protein. So all these that we're about to look at, or a lot of this is made up of proteins. And it's also a type of protein that people don't eat enough of, because you'd have to eat like certain animal parts, like the bone marrow, the skin of the chicken and the fish, for example, and you'll get this particular type of protein. But we don't. Usually Americans like get rid of those parts and just stick with the meat itself. So we're actually being deprived of our collagen protein. So you can either supplement with it, which is the easiest thing to do, and just in the morning, you just put a scoop into your water, and then you have your dose for the day. That will also help you prevent the cartilage. Okay, so you have the hyaluronic acid and collagen fibers that help make up the cartilage. And so if you want to try to resist cartilage degeneration or erosion of cartilage over time, which is, some of your arthritis stuff, you'll want your trace minerals that we just covered and your collagen. Okay, and then here's the proteoglycans. That's what they look like under a microscope. And you can see the proteoglycans here, which are also attract a lot of water. Okay, that's what helps keeps things hydrated. Okay, here's an example of a disc in your spine that can degenerate. Okay, and this is can be quick version is poor diet and lifestyle, so sedentary, not moving, not exercising, not strength training, not getting your proteins, not getting your collagen, your hyaluronic acid, not staying hydrated. So as time goes by, it literally just starts to rot because it's being deprived of nutrients, oxygen, blood, proteins. Okay, on this side, the healthy disc has, the hyaluron in it, the proteoglycans, okay, that you can see there, adequate hydration. Now we're going to talk more about this later when we get to deeper into disc anatomy. So some more pictures of the hydroxyapatite, the collagen, the proteoglycans, and other minerals that are found in bone. Okay, and then again, more proteoglycans, and here's your collagen. This is actually your extracellular matrix. So these are the components found on the outside of the cell. And here's intracellular matrix. Okay, so things that are found on the inside of the cell. Another picture of the components of extracellular matrix, so the proteoglycans, collagen fibers, these are all proteins. And then, of course, you want to stay hydrated, so lots of water. Okay, we have four types of bone: long bone, short bone, flat bone, and irregular bone. Okay, long bone is longer than it is wider. So an example would be a femur, which is your thigh bone, or the humerus, which is your arm bone. Okay, short bones are about as wide as they are long. So almost look at them like a dice, like a game dice. Good example would be your wrist bones. So those are your carpal bones, and your ankle bones or tarsal bones. Okay, flat bones are they're thin and flat shaped. Examples would be the skull bones, like the parietal bone, for example, the frontal lobe, or excuse me, the frontal bone. The lobes of the brain are named after the skull bones that they are near. So the frontal bone, and then of course that brain part would be the frontal lobe. Ribs would be considered flat bone, the scapula, so that's your shoulder blade, and the sternum or your breastbone. So those are flat bones. And then irregular bones, like your vertebra, so that's in your spine, and facial bones, because they have a bunch of irregular shapes to it. So they get the name irregular bone. Okay, the diaphysis and epiphysis and all this, I'm going to actually, all of these, we're going to just look at them through the picture. Okay, so this is young bone, and this is an adult bone. And some differences you'll see is a growth plate you'll find in youth bone. and that specifically is called the epiphyseal plate. Okay, then in the adult bone, the remnant of the growth plate is called the epiphyseal line. Okay, you'll also, the inside of bone is called the medullary cavity, and that's where the bone marrow is. Okay, and here is the medullary cavity in the adult bone. Now, in the young bone, the medullary cavity is going to be filled with mostly red marrow, and the red marrow is what produces your red blood cells. And in the adult bone, it turns into yellow marrow. Okay, so that's actually the fat. Now, the adult bone still has red marrow, and that's going to be more confined to the end of the bone. But you're also going to find some yellow marrow in the adult bone. Okay, the epiphysis is the outside or the distal end of the bones. Okay, the epiphysis, the proximal and distal end. So there's epiphysis. Well, let's go down to this one. So there's an epiphysis and there's an epiphysis. It just simply means the end of the bone. So you have a proximal end and a distal end. Okay, the outside most part of bone is called cancellous bone. Or excuse me, compact bone. Okay, the outside is called compact bone because it is thick and tough. It's dense. Okay, so that's compact bone, the outside part. The inside part is called cancellous bone. Okay, so it's got a lacy network. As you can see here, a lacy network called cancellous bones. And so what that does is it gives you strength without all the weight. So it's not solid all the way through. It's only solid on the outside, so the compact part. And then cancellous bone, also known as spongy bone, on the inside. Okay, also the outside skin of bone is called the periosteum. Okay, the outside skin of the bone is the periosteum. The inside lining of bone is called the endosteum. Okay, here's another picture of the periosteum. And so you can look at that as like the outer skin of bone. It's highly vascularized, so there's a lot of blood vessels, as you can see there, the blue and the red representing the blood vessels. It's also has a lot of nerves. Okay, so it's highly innervated. Since the red blood cells are made within the bone, it has to get out, right? So there's blood vessel systems that transport blood from the inside of the bone to the outside of the bone called the central canals. And so as a result, they make these little tunnels, okay, with connecting vessels and so forth. Okay, the length of the bone right here is called the diaphysis. So the long central shaft is called the diaphysis. Okay, and that is up here. Okay, the diaphysis, the long central shaft, the epiphysis, which means upon growth, is the ends of the long bone, so the proximal and distal end. Articular cartilage covers the end of the bone. So people just simply say cartilage, okay, like the cartilage in my knee or the cartilage in my shoulder. Okay, so these next slides are going to look at the enthesis. Okay, so right here, we said that the outside of bone is the periosteum. Okay, what ends up happening is a muscle tapers into a tendon and attaches to bone. Okay, specifically where that tendon embeds itself into is the periosteum of bone, and that is called the enthesis. Okay, a ligament is also embeds itself into the periosteum of bone, and it's also called the enthesis. So the enthesis is simply the connecting point of where the tendon actually embeds itself into bone, okay, or the ligament embeds itself into bone. Okay, now this area can get inflamed. Okay, so you can get inflammation at the enthesis. So an example of inflammation would be like shin splints. Okay, or tennis elbow or golfer's elbow. So those are, all that is technically enthesiopathy. And what is that? Simply inflammation of the tendon or the ligament or both and the bone itself. And you actually create little micro tears in the periosteum of bone. Not seen on x-ray, it's too small, but that's what shin splints are. So what happens is when you're running, your foot goes up and down, and there's a muscle called the anterior tibialis that connects to your shin, and there's excessive pulling on the enthesis, and it's too much. So if it's too much with the repetitive motions, you start to get inflammation and little micro tears in that periosteum. And so it's the same idea with tennis elbow and golfer's elbow. Okay, so it's just repetitive motion over and over again. It's too much stress, too much pulling, micro tears start to happen, inflammation. So there's your enthesiopathy. And that can happen anywhere in the body. It's not just limited to the shins and the elbow area through golfers or tennis elbow. Okay, any area of the body can experience a repetitive motion injury, inflammation of the enthesis, and so the tendon or ligament or both and the bone is inflamed. Okay, the medullary cavity has both the red and the yellow marrow. And then the red marrow, that never stops, right? Never stops producing red blood cells, so that'll be a forever thing. Okay, osteoblasts. All right, so blasts build. Okay, now it doesn't sound like that would be a thing, because when we think of the word blast, we think of destruction. But in this case, in the anatomy or medical terminology world, blast actually means build. Okay, so that is the suffix, right? So if you take a word, in this case osteoblast, we're going to divide the word. So blast means build, and it is attached to the word osteo, which means bone. So this is letting you know it's building bone. Okay, the opposite of osteoblast is an osteoclast. Okay, so clast breaks down. Okay, a clast will break down. And since clast is attached to the word osteo, it's going to break down bone. So osteoblast does repair and remodeling, and osteoclast will break down. Okay, so here's a couple pictures of an osteoblast, okay, and how it works. And Okay, it's going to take your hydroxyapatite and the calcium and the other minerals in the body, and it's going to literally lay it down. Okay, it's going to help build bone. Okay, and there's your osteoblast. Okay, and our bones are constantly under remodeling. Okay, you don't just grow bone and then it's just and that's it. Once you turn 18, like your bones just stop growing, stop remodeling or working or whatever. They're constantly remodeling. Okay, this is why it's important to have a healthy diet and lifestyle and make sure you're getting your minerals and some sort of weight-bearing activity. And that's very important in youth because that is the best time to build strong bones as you age into your skeleton. And then you maintain it as an adult. In fact, if you stop all of this stuff, your bones will actually become brittle. And that's osteoporosis. And, kind of classically, you'll see that in your seniors, someone in their 70s or 80s. But you can actually get that at any age if you based on diet and lifestyle, right? So you become sedentary and demineralization, stop exercising, all that stuff. You're going to start to get soft bones because bones are constantly remodeling themselves. Okay, so we looked at this just a little bit ago, the difference between compact bone and cancellous bone. So compact's the thicker part of bone, the dense part. Cancellous is also known as spongy bone. That was that lacy area. Okay, here's a close-up of the spongy bone. And that lacy network is called a trabecula. So you get these beams, and so you still get the strength without all the weight of spongy bone. Okay, here's another picture of the periosteum. You can see that outer skin of bone being peeled back. Okay, so a baby in utero essentially has a hyaline. The bones are actually hyaline cartilage. Okay, so it starts out as a cartilage, and what happens is it starts to ossify. So the ossification process occurs in utero all the way until around the age of 18 to 22, where the skeleton is considered mature around that age. Okay, so everybody's a little bit different when you reach full skeletal maturity. So it's somewhere between 18 and 22. So this is one reason why little kids, like take a 2-year-old, if they fall, and even from a pretty significant height, they tend to just get right back up. I mean, their bones are actually kind of soft. And plus that age, they can recover from things very quickly. But you can also see that the areas that have virtually no mineralization yet, the X-ray beams are just passing right through, so it gives that appearance that there's nothing there. Okay. All right, here is an X-ray of bone. Okay, remember your first rule of imaging, so whether it's X-ray, MRI, CT, ultrasound, your first rule is what am I looking at? Okay, what is the X-ray part or the MRI part? Okay, now in this case, we're looking at a hip. Okay, so there's your femur and part of the pelvis. And then in this X-ray, you can tell that it is youth bone because you can see the growth plate. Okay, you can see the line that's going through that femur head right there. Okay, there's also a growth plate here and a growth plate there. So even if you didn't know the history or the age or anything of the person, just by looking at the film, you can tell it's youth bone. On this one, this is your fibula bone, and the bigger one is your tibia bone. So this is the lower leg. And you can also see the growth plates, the growth plate lines, the epiphyseal plates that are there. So that's what's going to help with growth. Okay, as far as proximal and distal, so this end with the P, that's proximal. And then over here, this is distal. Okay, the way proximal and distal works, just as a reminder, one way you can reference the heart, and then you can ask yourself, you're looking at a part of the body, okay, what part is closer to the heart and what part is farther away from the heart? Okay, so in this case, this is actually the knee area, and there's your ankle area. Okay, so if you simply look at someone's knee versus someone's ankle, then you ask yourself, okay, which part is closer to the heart? Well, in this case, the answer would be up here. So that makes that the proximal end, and then it makes down here the distal end. Okay. All right, you also see it in this picture here, proximal and distal. So the proximal femur and the distal femur. All right, so here's a clinical condition. This one is commonly seen on boards, so you might want to know this and not forget it. And that condition is called leg calf perthes. Okay, so we'll get to that in a second. So the blood supply, so you can see the blood vessels that are supplying the femur head. Okay, supplying the femur head. If the blood supply to the femur head gets cut off, then the bone is going to die. I mean, that kind of makes sense, right? If there's no more blood supply to tissue, then tissue can die. So in this case, the bone is dying. And that is called avascular necrosis. Okay, so A means without, and it's attached to the word vascular, which implies blood supply. So if it's avascular, it means without blood supply. Okay, and necrosis means tissue death. So in this case, it literally translates to tissue death because of lack of blood supply. So avascular necrosis. And on x-ray, you can see the evidence of that. So that sclerotic, white part right here on bone. On top of the patient's history, so likely, they'd come in with some pain, a limp, things like that, and you get your x-ray and you're like, okay, we're dealing with avascular necrosis. All right, so in a kid, that's actually called leg calf perthes disease. Okay, so there are a lot of conditions and diagnosis stuff out there that is named after the people that that researched it, founded it, wrote about it. And if you do that and you're the first ones to do it, then they'll usually name it after you. Okay, like another example of that would be like Down's syndrome. So it's named after Dr. Downs. Parkinson's, named after Parkinson's, and so on, right? You can just, there's a thyroid condition called Hashimoto's. Well, there was a doctor named Hashimoto that discovered all that stuff. So there's a lot of conditions out there that are named after the doc or the research person that founded it. Okay, so in this case, it's leg calf perthes. The reason why I say that is because a lot of these conditions that are named after someone doesn't make sense. Like, how would you know that leg calf perthes is avascular necrosis? Like, that doesn't make sense if you look at it from a medical terminology perspective. So some of these things, you just have to memorize it. You just have to make that association through memorization that this condition which is named after a person, is, here it is. Okay, in this case, leg calf perthes. All right, so you're seeing the x-ray here of the hip. You're seeing how there is basically erosion of the femur head, which isn't good to have that. Okay, you're going to alter the carrying angle in that femur head, so that means the leg's going to shorten. So one leg will be longer than the other. So that alone can cause a whole slew of problems. So if left untreated, it is self-limiting within 2 to 8 years, but it does result in a deformity of that femur head. Signs and symptoms, so the SS there is a shorthand for signs and symptoms. Groin pain, a limp, painful range of motion, so ROM is range of motion, and muscle atrophy. It's caused by trauma, infection, genetic inflammation. This should say poor nutrition, such as vitamin D and calcium deficiency would be an example, or altered circulatory system. And then there are surgeries that can be done to help. Okay, so if you're looking at, so remember your first rule of looking at an image is what am I looking at? And this is a pelvis. Okay, you can see the hips. And so we're going to call this side number 1. We'll call the other side number 2. And if you look at both sides, look at number 1 and look at number 2, you'll see a difference. Number 1 is all deformed and busted up, and number 2 is normal. Okay, because of the shape of the femur head. And then you can tell by just the way the femur head looks on number 1 there that it is abnormal. Okay, so there's a little bit of radiology for you. So here's what happens when the bone starts to die because of lack of blood supply. Something happened to that lateral femoral circumflex artery, and it just cut off blood supply, and so the bone started to die. Okay, another x-ray of the hip showing you the progressive process of leg calf perthes. Okay, so here's some real cases where you have a hip. So here's your x-ray. You'll notice that the pelvis is way off as far as alignment there, and you've got the diseased bone, and the treatment is unfortunately a little rough, where they have to put the child in where both legs are in and adducted. Okay, so adduction, abduction. Okay, so abduction, which means away from the midline, right? So if you take the leg and move it away from the midline, that is abduction or abduction. And it's casted, and they're held in that position for a while to try to help with the correction to the femoral head there. Okay, some other pictures of some medical procedures to help with leg calf perthes.